My message today should be very clear. We are not in a position to play around with this particular virus. We have to use social distancing. I'm going to tell you why. Because social distancing is our medicine for this virus. It's not the testing that everybody thinks. Testing is for public health officials like me who want to determine the spread. But it's the social distancing that's going to save people's lives. I have to say it again. Social distancing is going to help people save lives. I had a call today who told me about some seniors who wanted to go out and do we have masks for those seniors? I told them those seniors should be at home. They don't need to be out. They need to be at home. Social distancing is important because it prevents the spread. That's the medicine, not the test. We have people running in lines to try to get tested. The test is for doctors. And I want to be very clear about that because getting tested is not going to make you better. Whether you know you have COVID-19 or not doesn't make a particle of difference. What is going to make a difference? Well, it's going to be you covering your mouth when you sneeze, not being around people where you can get the virus, being home and keeping yourself healthy. That's what I have to emphasize. This is a time where we have to keep ourselves healthy. We're not going to get this overwhelming disease spread if we keep ourselves healthy and we use this social distancing. It's really what we have to do. It's only the doctor who can determine whether you need a test. And the doctors are testing so that we can determine the spread. So primarily, if you are a person who came in contact with somebody who has COVID-19, then we're going to test you. We're going to tell you to socialize. We're going to tell you to go. Don't get around anybody. We're telling everybody that now. But we're also going to test you. Or if anything happens in a nursing home, you know we're going to test those folks, right? We're going to test the people in the nursing home. And if you're in the hospital and you started getting worse, we're going to test you too, especially if you're having respiratory symptoms. But everybody else, we're not going to test. I've been a doctor for 40 years. I'm going to tell you right now, if I have a patient who calls me and they say, I'm having these symptoms, I'm going to follow the symptoms. I'm not going to worry about testing them for the flu or anything else. I'm going to test them only if I can't figure out what they have. Now, that's important. We don't need long lines of folks trying to get a test because you're exposing all the people in the line. I want you to stay at home. Social distancing. We got to do this. So one of the things I want to be very clear about is that if we don't practice social distancing, then we put our older people at risk. And so why are we shutting down everything? Because we've got to do this. This is a change in how we're going to be. And as the public health person, I have to be sure that this happens. As the doctor, I want to be sure that everybody gets better. I hope that's clear. Prince Georgians need to focus on following the advice of public health experts and stay in their homes as much as possible. This is teamwork. We have to normalize doing things a little differently. Yeah, it's going to be awkward because we're bumping shoulders and we're staying 6 feet away. But that's what we're going to need to do to get through this. This virus is coming at us fast and hard. I know you all know the last time I was up here I said we have a few, now we have more. It's going to get worse. We're not going to be able to keep up with all of the positive cases. We don't need to. What we need to do is stay at home, do your social distancing. It's important. These are just temporary sacrifices. Right now, this is just to reduce the number of people around. It's temporary. It's not going to last forever. But it's got to happen now. It's really important that it does. This will slow down the spread of the disease. So this is a national call to action, social distancing. And when we say it, I don't want to say social. Just stay 6 feet away from people as much as you can. That's social distancing. Do that. That's our call to action. And I have to do this because I can't sleep at night. Because I know if I don't tell you this in the most forceful way I can, then I'm going to have people who lose their lives. I can't afford that. That is not why the county executive hired me. I have to protect lives in this county. I'm not trying to scare you, but I am trying to scare you. You know, as a doctor, and I have bad news to tell somebody, I tell them the bad news, then I tell them how to get through it. I don't hold it back, and I'm not holding it back from you all. What we have to do is do this right now. Don't go to the X, Y, or Z to play cards. No, you got to stay at home. You understand what I mean? It's not entertainment time. Netflix is on. Watch some Netflix at home. You know, this is not time for it. It's time for us to stay at home. So having said that, I want you now to take care of yourself. Get some sleep, eat right, exercise, catch up on the Netflix, like I said. Stay at home. I want you to stop this spread. Thank you.
Thank you, Dr. Carter.
You're welcome.